Number 34, which is a resolution proclaiming August 31st as Overdose Awareness Day. And I'd like to ask Nick Drew and Star Graber to come to the podium. And Supervisor Ortiz-Legg will be doing the honors.
Thank you, Chair. This resolution proclaiming August 31st as Overdose Awareness Day in San Luis Obispo County, whereas San Luis Obispo County has the 12th highest opioid-related overdose death rate in the state, marked by a 347% increase in opioid-related overdose deaths since 2017, and over a 2,500% increase in fentanyl-related overdose deaths since 2017, with at least 655 lives saved with naloxone. Thank you, naloxone, in 2022. Whereas in California, preventable drug-related overdose deaths have doubled since 2017. In 2021, 10,898 people in California died from drug-related overdose, which is equal to nearly 27 preventable drug-related overdose deaths per 100,000 people. And whereas a person living in the United States is now more likely to die from an accidental overdose than from a motor vehicle crash, with drug overdoses reaching an all-time high, taking 270 lives each day in 2021. And whereas recovery can and does happen, and all of San Luis Obispo County community members should know that support and help is available regardless of any individual situation, whereas creating a community where everyone feels prepared to prevent overdose and empowered to reach out for the support they deserve is crucial to saving lives, and whereas access to treatment and harm reduction support and ending the stigma of substance use is paramount to ending overdose. Now therefore be it resolved that the Board of Supervisors, County of San Luis Obispo, State of California, does hereby proclaim August 31st as Overdose Awareness Day to enhance public awareness and the impact of drug overdose on the community.
Thank you to the board. Nick Drews, Health Agency Director, and I appreciate the opportunity of being here today and speaking on this resolution proclaiming August 31st as Overdose Awareness Day. Largely because this matters. This really matters to us. Drug overdose is the leading cause of accidental death in the United States, and it's responsible for a growing number of deaths here in San Luis Obispo County. I appreciate the statistics that were read. I think they're profound. If you think about it, between the dates of 2017 and 2021, we saw a dramatic increase, 41 deaths, from 41 deaths to 123 deaths. That's an incredible increase in deaths in over a short amount of time. In 2017, for instance, 7% of the total overdose deaths involved fentanyl. In 2021, 60% of the total overdose deaths involved fentanyl. That was 3 in 2017. And today, in 2021, that was 74. When what we're seeing is an increase that continues, this is not something that's going away. Another number that I think is profound and we need to say every time we're up here is that in our county, 3 deaths are related to an overdose related to fentanyl or opioids every single week. So 3 people are dying every single week from opioids. And it's something that I appreciate you giving us the time to talk about, but it's also something that we're working on. This is not something that we're staying idle as a health agency. There are a lot of actions that are taking place, and that's why I appreciate Dr. Star Graber being up here with us today from the Behavioral Health Department to talk about some of the things that we're doing.
I wanted to mention, thank you so much for recognition of Overdose Awareness Day. Overdose Awareness Day was brought forward in this county by Kim Lacey, and I want to just thank her as a private citizen coming forward to bring awareness, to help us kind of recognize this day, both the deaths that have happened as well as the rescues. We're working with hospitals in inducting medication services in the emergency room in the hospital. We have treatment available, medication-assisted treatment, in a variety of different ways, as well as the harm reduction strategies, such as the syringe exchange program and naloxone distribution. Our naloxone distribution is one of the highest in this county, in the state. And I really want to thank everyone, from doctors to private citizens to organizations, all coming together, because in reality, that's what it's going to take. Thank you.
Thank you.
Thank you.
Thank you. See if there's any additional public comment. Yes, District Attorney Dan Dow.
Yes, Mr. Chair and Board, I'm really grateful for your board taking the opportunity to recognize the dangers of opioid use and the overdoses that are happening in our community. As has been mentioned by Mr. Drew and Dr. Graber, it's truly a remarkable problem that our community is facing. It's not, however, just someone that's using and abusing illicit drugs that somehow takes too much and dies. Too many times we've had young people in our community and across the state that are purchasing what they believe to be a Xanax pill or a Percocet, some other kind of prescription medication that they weren't able to get a prescription for, and then use that pill that was laced with fentanyl. These pills have been manufactured in China and in Mexico and are being distributed into our state and across our country because of they know that it's a very lucrative market for them to be in. And so they are marketing these drugs, and unsuspecting individuals taking these medications that they believe to be safe. If it was a pharmaceutical approved and manufactured item, it would be a therapeutic dose. Unfortunately, because the cartels and those in China that are manufacturing the fake pharmaceuticals don't abide by the pharmaceutical regulations, they often have a fatal dose in fentanyl. Fentanyl deaths now, as I think the statistics were already talked about, they've now surpassed car accident deaths, firearms deaths, suicide, and other illness, and particularly among those 18 to 45. So this Awareness Day is incredibly important. But I want also your board to know and the community to know that our office and our law enforcement partners in the community treat this issue as a criminal issue when a drug dealer is selling these fake pharmaceuticals to our youth and vulnerable individuals in our community. A woman from Atascadero named Cami Velci lost her 19-year-old son. And you know, who can fathom the loss of your child to this? He thought he was buying a pharmaceutical from a street dealer, albeit they shouldn't be buying from a street dealer, but he was not intending to take fentanyl. He was not intending to take an opioid, he was intending to take a therapeutic dose for some kind of a dental issue that he had at the time, and he died. So our office was able to file murder charges against the dealer who sold that, and since then the U.S. Attorney took the case from us and is prosecuting the dealer in federal court. We have another case right now pending where an individual sold fentanyl knowing that it was deadly dangerous, and the person that received it and consumed it died, and so we're charging that individual as well with murder. So I want part of this discussion to be not only that it could happen because somebody takes too much of a substance they know they're taking, but too often young people are experimenting and trying things that they have no idea contain fentanyl, and it will be the last pill that they take in their lifetime. So that's an important piece. I want to commend Dr. Graber and Mr. Drews and all of your staff at Drug and Alcohol that do so much for the rehabilitation end in this awareness piece. So thank you very much.
Thank you. Any additional public comment? Seeing none, we'll close this and bring it back to the board for any additional. Supervisor Arnold.
Yep, this one's a tough subject, and I appreciate all that you do and have done for so many years, and I know it must be frustrating to see these statistics going the wrong direction, but we all hang in there, and like you say, Dr. Graber, just work together and hopefully reverse the trend. Thank you.
Supervisor Ortiz-Lang.
Yeah, thank you so much to come in. And again, I think that recognizing the individual who brought this forth and recognizing the mother who lost the son, I mean, this is, you know, this is our community. This is happening to us. So the numbers are stunning. That's all you can say. And what's really concerning is that the pharmaceutical, we get our arms around one and here comes a new one. And it's just, I mean, there's a bigger awareness campaign it has to be out there as well in regards to folks just looking to a pill for something that may be so much more than what you bargained for. But it's, you know, it ties in everything from innocent families to our unhoused to, you know, on and on. And so it's just a really important subject, though. Thank you for helping us tackle it.
Supervisor Gibson.
Thank you, Mr. Chairman. The numbers are indeed horrifying, and I think it is incredibly important that we make clear to the public the magnitude of this problem. But to me, that's just the start, because what we need to do is use this as a springboard to continue a drive to strengthen our substance use disorder therapeutics so that we can put an end to this. In and of itself, reviving folks with the miracle of naloxone is a great thing. But until we as a community, we as a society, we as a government really commit to furthering the substance abuse therapeutics, we're going to be fighting this for a long time. So I appreciate everyone bringing this forward. I look forward to progress on this deeply distressing issue.
And I'll also add, you know, this has affected families all across this county, across the country, and it is not unique to us, but I will tell you that it has affected all the families. I know many families in my district that I represent. I will tell anybody who's listening that if you do have an addiction problem, we at the county do have services available to help you beat the addiction. So please contact us. With that, thank you very much for being here today.